Thanks. All right, so hi everyone, I'm Filip. I'm actually from Heliant, but I'm here to present the University Clinical Center of Serbia story in the EHDEN COVID project. So let's begin. So what we're going to talk about is basically the background, the ETL process, the vocabularies that we've used, the data quality, studies that we've tried, and also some concluding notes. So as for the background, where is Serbia? Serbia is a smallish country in the southeast of Serbia, in southeast of Europe, with 7 million people and a nominal GDP of about $52 billion. So the stakeholders, the key stakeholders that participated in this project were obviously the University Clinical Center of Serbia, who is the official data partner, but also the data custodian. They own the data. Clinerion was instrumental in helping us with quality control and setting up the environment. So they are the certified SME that participated here as well. And Heliant is the subcontractor. I'm representing Heliant, and we're the data source. Our database and our health information system is basically what was used in this. So a bit about the clinical center. It was established in 1983 formally, but it has existed as a series of institutes much prior to that. They cover 50 buildings in almost 300,000 square meters, and with almost 3,500 beds, they're the largest hospital in Europe in those terms. Out of 5,500 and more medical staff, about 1,500 are doctors. So there are many different organizational units, and similar to what Selçuk said about University of Istanbul, there are about 100,000 inpatient visits annually and about 1 million hospital days and about 1 million outpatient visits annually. So these are the people who have participated in this project. They're mostly epidemiologists, pulmonologists, epidemiologists from the Clinical Center of Serbia, and they helped us with mapping of data or vocabularies. Heliant as a company helped out with the health information system, the Heliant Health, but we also produce other software in health, like laboratory information systems, ERPs, business intelligence solutions, connection solutions, mobile apps, and registries. So as a Heliant Health, we cover more than 200 institutions, both in a private and country, state sector. We have about 85 employees, and we have 20 years of experience, and about 40,000 users use our software daily. And we think that about 85% of doctors in primary healthcare and 75% in secondary and tertiary healthcare use Heliant in Serbia. This is the Heliant team that participated in this project. I'm the tech lead of Heliant, and I was the project coordinator. Vanya, who's also on this call, is a developer who helped us with ETL development. In the bottom row, you'll see 3 doctors and 1 biochemist who helped us with the mapping of all the necessary vocabularies. Of course, a great shout out to the EHDEN core team, without whose help this wouldn't be possible. So Erica, Peter, and Sebastian, thank you for these daily, well, weekly meetings and insights that we got from you. So about the process, I'm not sure how many of you guys know this process, who has started or who has already completed it, but basically, if you do anything with Odyssey and EHDEN, you'll see something like this, a diagram that has many parallel lines and many activities. It looks daunting at first, but in fact, when you go through it, it doesn't seem all that bad. It's quite straightforward. So this is what it's supposed to look like in action. Well, what we had was pretty much this. We started after our kickoffs meeting and at the end of August. We had our first activities in September. The first phase was basically done in the first 3 months, and that was the most extensive phase, basically the dataset profiling and ETL design. We spent a lot of time thinking about the design and holding several workshops with core teams to be able to map this as good as possible. We also took a long time to do the mapping of the source vocabularies, because it takes a lot of time to actually reach higher percentages for many of those vocabularies. Some of these steps didn't really require too much time because they were technical and quite easy for us. But the ETL development was, I think, the step that took the longest individually, and it helped us basically. Well, it lasted until end of March. Basically, that's when we were ready to do the ETL testing, final ETL testing and data quality assessment. Although you can see that we did some things in parallel, because this we figured was an iterative process, so that once we do the think we're done with the ETL tech development, then we do the testing and data quality assessment, and then go back to the development because we found out some problems, etc. So in several iterations, we were able to finalize the project in April when we we're ready basically for the studies. So I'll go quickly through all these steps. So we use the White Rabbit first. Although you can see the screenshot here, we found much more use from the command line tool, because it offered us an opportunity to curate the concrete tables much more easily, because Heliant has over 700 tables, but we only needed several dozen tables for this mapping. So with this, we could scan the source data, we could get detailed information, and basically about the tables, fields, and values. This is something like that. White Rabbit produces this Excel file, which then helps us understand the data more easily, although we do understand it pretty well. But then also it's a plug for the next tool, Rabbit in a Hat, which we use to connect the source tables to the OMOP concepts on 2 levels, on the table/concept level, but also on the column/detail level. And once we managed to do that, this is the actual case. We managed to export this in two ways. One is the Word documents for the ETL design documentation, and the other one is the SQL skeleton, which helped us create the ETL implementation. A bit more about that later. So this is what it looks like for a few tables. The first one is the visit occurrence, contact in Serbian, and the second one is drug exposure, practice and proizvod for Serbian. After that, in parallel, we use Usagi, which is, I think, one of my more favorite tools here. It really helps map local vocabularies to standard ones like Loink or SNOMED. It's quite easy to search through them, and I always use ranking by the score, but it doesn't necessarily mean that the highest ranking is the most appropriate value. And also after this, we could export everything to the source to concept map format, which is then used in the ETL implementation. So a very interesting tool. So as for the tech architecture design, we basically had to evaluate what we have for data. So we had close to 1 million patients, several million visits, and drug dispensations, and test results, and medical reports. So and we had data from 2019 onwards, and also some from before that, mostly legacy data. So when we figured that was like 300 gigs of data, and additionally 70 gigabytes of indexes more. So we managed to get a server for EHDEN that we wanted. Well, not the one we wanted, but in any case, the ETL technical development was something that, as I said, took a lot of time. This structure of folders and files is on our SVN system, but basically the whole process goes like this. A part of the source data is dumped from the production database server as a SQL file, which is then loaded in the local instance, MySQL instance on the EHDEN server, be it the test server or production server, and then some MySQL queries are run to initially narrow down the data, which is then dumped to CSV files and then loaded into PostgreSQL, PostgreSQL platform, which is also installed on the EHDEN server, and then the further queries, the final queries are actually used to the insert and update statements to import data into OMOP CDM. And this process is fully automated, so once we drag the dump to the EHDEN server, then everything goes automatically from there on until we have everything in OMOP CDM. So setting up the infrastructure, this is the actual server, the production server that we use. So we have 4 cores and 8 gigs of RAM, and we hope that we could upgrade that so we can have a much more streamlined process and a faster process. But as I said, we have a local test server and a production server. So yeah, that's it. So other tools that we had to install, basically Atlas, which is a web app that hosts other apps like Achilles from Odyssey. R and R Studio were used to be able to install Hades, which is a group of R libraries, and pgadmin was used for client-side checks on and queries on the database. From Odyssey tools, obviously data quality dashboard, catalog export, and inspection report are regular tools in the Odyssey suite of tools that are necessary for this sort of task. So as you can see, this is the pgadmin display. What we needed to do when we created the database was basically create the empty CDM and install it on the Postgres instance, and also load the vocabularies that we downloaded from Athena, which we did several times because we needed to add more vocabularies. And just a tip there, if you need to add more vocabularies, just clean the whole vocabulary table and insert from start. We had some troubles when we wanted to incrementally update the vocabularies. So we also did some testing of the ETL, basically reviewing the code, comparing the samples, concrete examples, and then also overall counts so that everything checks out. So with regards to vocabularies, I'm not going to go into that too deep, but basically ICD-10 is used in the data source for conditions, so we didn't have too much problem there. We used source to standard queries, but also for drugs, we had JKL, which is a Serbian-only classification, which we had help from Sebastian and Mace to have the map to RX norm, and procedures, lab tests, and measurements were done. Were mapped using Usagi, and some of the observations, measurements, and notes are from the textual and numerical fields in Heliant that were mostly related to COVID. So regarding data quality, we use Achilles, obviously. That's the first tool that we need to use to get the characterization of the data source. And this looked fine at first. We also used the Achilles heel, which then we found out that wasn't really updated anymore and should not be used regularly, but it really did help us narrow down some of the early errors that we had in the ETL implementation. But the data quality dashboard was something that actually gave us better insight into some of the nitty-gritty details. So at first we had 99%, and we managed to narrow it down to 100%. Of course, we still have 11 fails, but it's not too big a deal. Some of those cannot be solved at this point. Some of those might be able, we might be able to solve. They pertain to data quality of the source data, meaning that clinicians didn't do something well, and we're trying to fix that. So we're going to spend some more time doing this in the next projects. So the next step is basically when we're done with data quality is to upload the generated file to the data catalog, and this is what we obviously did. After that, we generated the inspection report. It's a great tool because it does a lot of work that you would normally do by hand. So you probably, after this, you need to fill out the red fields, basically to type the natural language descriptions regarding some of the missing things that the computer cannot get on its own. But yeah, the inspection report is that. And studies that we've tried to participate, what we had initially was the EMA COVID feasibility, which seemed to work fine because it did narrow down some things, and it seems like we do have some data to support that study. We also tried AESI for COVID vaccines, but we didn't have any visualization there. We only had an Excel file. And eCore Diagnostic, this is the latest one. We did get some visualizations, but we're still in contact with Clinerion and the EMA to see what are the next steps for this. So in conclusion, we completed the whole process. It was a daunting task. It took us 6+ months, but I think the regular meetings with the core team, basically weekly meetings, really helped us keep the pace and also make sure that we're on the right track. Clinarion's help was also indispensable in terms of infrastructure setup and inspection report. As for the data, we focused on the COVID-19 data, but we also try to have the wide coverage of types of data notwithstanding, meaning that some of the concepts we try to address without really thinking about only COVID, but thinking more broadly. And also we managed to reach 90+% of mappings for all the vocabularies. So in the end, we have about more than 20 million measurements, close to 20 million procedures, 11 million drug exposures, and about 4 million condition occurrences. So the next steps are basically to progress with the data partner call, which we're in progress. We're in the phase 2, basically doing the ETL development and also some more vocabulary mapping, and in some places we reached 98%, or close to 99. Heliant also got accepted for SME certification, so we're waiting for that. And also, as Heliant, we're also trying to, we applied for data partner calls for 2 other hospitals in Serbia. So that's it for me. Thank you.